Hi, everyone. I'm Jayme Simões. I'm here for Protect Our Care New Hampshire, and we're here today to discuss the 2026 Affordable Care Act, or the ACA open enrollment period, which comes amid an unprecedented federal government shutdown and growing policy uncertainty. Open enrollment began on November 1st, and this year, tens of thousands of Granite Staters face potential premium increases of up to 26% or more if Congress fails to renew the enhanced premium tax credits. According to KFF, these subsidies have been critical in keeping coverage affordable for more than 50,000 New Hampshire residents since 2021. And to talk about what's going on and look at open enrollment, I am joined today by Tory Jennison, the Executive Director of the New Hampshire Public Health Association, and Ed Shanshala, who is the CEO of Ammonoosuc Community Health Services. We're going to try and explain what you need to know during this complex enrollment season, um, and also what's going on for strengthening public health throughout access to affordable care. I want to start with you, Tory. It's great to have you here. Thank you for joining us. So the loss of affordable coverage ripples throughout the broader public health system. What can New Hampshire people do to stay covered right now? And what should consumers do at this point to ensure that they get coverage in 2026? And where can they find help? I'm sorry, it's a lot of complex questions, but I'll toss that over to you.
Sure, that is a lot of complex and a lot of questions, and thank you for the invitation to join you today. Hopefully, we can clear up some and talk a little bit about when we might know more. So, yes, absolutely, there is a lot of uncertainty out there right now about what's going on in the marketplace as far as healthcare subsidy premiums, supports for premiums. We do know that there across the country, there are folks in every state seeing massive increases in their required contributions, the cost of their care. If the subsidies go away, they're going to be responsible for an even bigger percentage of their premiums than they already are. And we already know that some of those premium costs are very high and a burden to people trying to also keep up with increasing costs in healthcare that insurance doesn't cover, increased housing costs, increased food costs, increased childcare costs, and increased energy costs. So all of these things are increasing. Wages are not increasing to accommodate them. And there are some things folks should be keeping in mind as they're getting ready to protect themselves and just try to put themselves in the best place possible to stay safe and well. One of those is to check the working with New Hampshire navigators through the ACA marketplace resource to get help finding coverage that works for your you know, providers, your network of providers. Not every plan is created equal. Plans can cost the same but cover different things. So you want to know kind of who you see the most, what medications you see, and you want to be able to kind of shop smartly for the plan that covers you the best. We also encourage folks to do everything they can not to lose their coverage because those gaps in care can lead to delays in seeking preventative health care, delays in getting care that you are hoping to get, that you need to schedule, and really just keep watching and listening as the government shutdown goes on, because a lot of the information we need to make those decisions is coming out very slowly, if it's coming out at all, because the resources that go into making those decisions and setting those kind of rules and pathways aren't functioning regularly, if they're functioning at all.
Thank you, Tori. I just want to add, I was on healthcare.gov this morning looking at my own plans, and I had a question, and I called the 800 number to talk to the folks at healthcare.gov, and I think I waited 5 minutes, talked to a perfectly lovely person who was very helpful. So not all is as lost as it would be, and it is good that some of those resources for the moment are still there. Um, so Ed, you sent me some numbers. which were very interesting. And I too get my coverage for the Affordable Care Act, as I just said. From your perspective, tell us what you're seeing.
So in Ammonoosuc, we have about 100 staff. We see 1 in 3 of the 30,000 residents in our community. So as an organization, we use what is called an individual coverage health reimbursement account, which is sometimes referred to as ICRA. Sorry for the alphabet soup. And it does a couple things. It provides some financial stability of the amount of money that we put into our employees' health plans. And then they go to the marketplace and they shop for what they want, what they need. A single plan, a plan plus one, maybe they have a family. We also have staff that live in Vermont, some live in New Hampshire. So we have to be sensitive. Those are two somewhat different markets and how they behave. So we do participate in the market. And when we have a plus one, personally, my wife and I have it. And if you think about gold, silver, bronze, it's in that silver middle of the road category. And Tory is exactly right. We have some prediction on what sorts of healthcare we will need. So, we're going to look at radiological services. We're going to look at, where the specialty care that we may use. Are they in network, which is important? And what sort of medications might we anticipate using in our selection? So this year, if we had followed through on we don't get tax co-investments. I like co-investments versus subsidies. Subsidies, I think, are inelegant language that is pejorative. I like to see it as we co-invest in our friends, family, and neighbors' health access. It's a co-investment, not a subsidy. And we don't have that. So when we looked at our premiums at the silver, it would go up 20 plus some percent. We're looking at $2,000 a month or $24,000 a year. That is a lot. So what we will end up doing is move to a bronze plan. And Tory's absolutely right. We will pay less and we'll get less. That the out-of-pocket exposure will be higher. Bit of a gamble. The coverage for if we do need certain types of coverage, we'll have to pay more later. So that'll keep our premium the same for less. So and bronze is kind of the bottom. I don't think there's much below that. So I worry about that. And then when I look at our staff, they're we pay them in a competitive way based on keeping us solvent. So that's important. I can't print money. There's rules against that. And then when I look at the state, we have roughly 85,000 healthcare employees. So they're part of that community that they provide care, and sometimes they have to receive care. So it is a challenge. And Tory's right about navigators. We actually have some internally. We have 2 internally who can help our patients and sometimes help people who aren't our patients. It's complex to navigate. And I think navigation is an apt term. They're helping you navigate a very complex environment. And everybody has unique needs. And I think it's important to sit down with someone who spends 40 hours a week in this area and help guide you through the process, ask you great questions, and ultimately you're going to have to make a decision.
I took a look, as I was saying earlier, at healthcare.gov, and there's some good news there, which is this. And there's a new player, WellSense, right? They're coming from Massachusetts, where they've, it sounds like built a good base for themselves, and some of their plans are very affordably priced, based on the experience they've had, south of the border in the Commonwealth. So that was good. I also saw that a lot of the silver plans had extra incentives and extra things built in. So if you've got a gold plan, you might find a silver plan for a couple $100 less a month, similar coverage. You've got to look at out of pocket, obviously. You've got to look at prescription drug costs. There's a lot to consider. But you're right, the Navigator program, there is still there, and it's put on this year again by the Foundation for Healthy Communities, NH Navigator. I'll just shout out their number, which is 877-211-NAVI, NAVI, which becomes actually 6284, because we don't live in the 1940s anymore when we spell that words. So, but there's some challenges. And I think, let's talk a little bit about those federal premium tax credits. what should Granite Staters understand about the potential expiration of them? And before I put that out to you, I think it's important, as we discussed, is to realize that there are still built in, we won't call them subsidies, right? We'll call them price help for people who earn, up to 50, 60, $70,000 a year to bring the cost down without those premium tax subsidies. Those were helping people on the higher end of the income scale to get a little bit more help and bring more people into the marketplace. So what are you seeing? What are you hearing? And how do you think that impacts this year's open enrollment? And I'll put it out to either of you who'd like to answer.
So I think one of the biggest things that's changing, or has the potential to change, is that support subsidies were available, cost sharing was available beyond 400% of the federal poverty level. So that's going to go away. So even folks who are, what we would consider higher earners are still at risk of experiencing cost burden. And that is a concern because of the impact that medical debt has on every other aspect of people's lives. The number one cause of bankruptcy is medical debt. Folks have to make hard choices around, do I pay for my food or electric bill or and that's one of the biggest challenges I'm sure Ed can speak to, is uncompensated costs. Even if you have insurance, if your insurance covers less, you are at risk of not being able to pay for more. So I'm concerned about some of the even for what we would consider higher income families, when the kind of current rules go away, eligibility is going to shift, and there's a potential for the cost sharing to also increase. So folks who were paying less are now paying more and getting less.
Yeah, I would agree that when we look at people make a decision, and one of the decisions may be, I'm not going to buy health insurance this year. And when they don't buy health insurance, maybe they don't come to see us in primary care. And when they don't see us in primary care, by the time certain things, diabetes and hypertension, become symptomatic and the individual realizes it's really far down the road, and there is some irreparable damage that is difficult, if not impossible, to undo: vascular damage, kidney damage. So on average, a primary care visit in the country is about $171. When we look at our emergency departments, and they're wonderful, they do great work in under an hour. That's kind of what they're there for. Those things that really need to be addressed right now in under an hour, and they do exceptional work. They're not designed for managing diabetes or hypertension. That's not what they're designed for. And from the price point, it's fair at the emergency level, but at $1,500 to $2,000 based on MEPS data, you should go do primary. And then in the event that they have no other choice but to admit you, then we're looking at a hospital day in New Hampshire, Kaiser Health Stats, 2,000 and up, 11,000 for a ICU visit. So I worry about that happening. And then when they present at the hospital and they don't have insurance and they don't qualify based on income for any sort of plans inside the hospital, then that'll drive up bad debt. And I've seen historically what happens to communities when acute care disappears. It causes an economic downward spiral. The economic multiplier is 3 to 1. For every dollar I invest of the 12 million in my staff, they buy a cup of coffee, they pay the mortgage, they buy their groceries. So it has a broader economic, it's almost like a China syndrome in healthcare that I worry about, in and above the fact that we have patients who may have less than optimal outcomes because they waited and they didn't feel bad. By the time you feel bad, it's probably really bad. So.
This is good advice, and obviously when you're uninsured, you also could be facing higher costs through some medical providers because the insurance companies have negotiated lower costs So not only you not have insurance, but it could end up being more expensive. Um, just a couple of dates. I think it's important as we're having this discussion to point out, open enrollment goes until January, but you need to either renew your plan or select a plan by the 15th of December to have that plan start working for you on January 1st. The first step for most folks in New Hampshire is to go onto healthcare.gov, update your income for 2025 estimates, so that you could see what kind of price support you get based on your family's income. And it's pretty easy to do. Either set up an account or you can use your existing account, obviously, if you have one. None of that is impacted by the shutdown. So just two quick questions that we're facing here. You know, we talk about challenges with our healthcare system in terms of equity. What populations in New Hampshire are at the greatest risk of losing coverage or delaying care in terms of healthcare and the open enrollment period and obviously healthcare disparities? And not related, but I'll follow up with people are worried about the government shutdown. It's hard to read what's going to happen next. What did the two of you see as the impacts of that on open enrollment and then on the Affordable Care Act going forward, should this thing not be settled in a few days or weeks? So I ask you both those two questions, and feel free to answer them if you'd like.
I'll take a stab at it. So, 40% of our patients are Medicareable. So it's a little bit outside of the marketplace. Yeah, in Coos County and Northern Grafton, the managed care for Medicare is down to one non-choice. And at least in some instances, these are leaving individuals. And this is kind of that ripple effect of confusion and uncertainty. They may have a specialist downstate, and that specialist may or may not take this managed Medicare product. And in fact, in a couple instances, they don't. So they're left going, well, what do I do? And they're going to have to spend some time with patient navigators because there are some ways to get back to fee for service with or without financial penalties. So I think about 40% of our patients on Medicare may be adversely affected. And in the event that it results in a healthcare entity going out of business, then everybody will be adversely affected no matter what your health insurance status is. So that cuts across the board. I worry about the youngest for sure. And as an example of a case study pre-Affordable Care Act, an entrepreneur, 30 to 40 years old, 2 kids and a spouse, presents at an emergency department with flu-like symptoms, and it was determined that they had diabetes. Unfortunately, the determination was during the autopsy. So society has lost a tradesperson, they've lost a spouse, they've lost a father or a mother. And if I can't appeal to your sense of humanity, the amount of economic churn that person would have developed over 10, 20, 30 years and buying a car and a fishing rod or taking a family out to dinner is lost as well. So those don't really want to go back to those times. And I think people have forgotten pre-existing conditions or lifetime burdens where a child survives cancer but can't get insurance for the rest of their life. These are things that the Affordable Care Act did and did so well that we've long since forgotten because we have a new normal. So those are the ones as entrepreneurs that are the fabric of our community, small businesses. They struggle as it is getting health insurance. I don't know what they're going to do. There's a lot of people who have a coffee shop here and a automobile shop there. They're our friends, family, and neighbors, and they're going to struggle.
I think Ed speaks really well to the nuances of where we need to be concerned. I think from a population health perspective, New Hampshire's done a great job of getting folks signed up for insurance. We have fewer than 5% of our population does not have insurance. That's what helps us be healthy. It's what contributes to the New Hampshire advantage with a reliable, stable workforce environment. It helps keep our healthcare systems in business because that is the sort of economic certainty they need to do good business. and reliable business and stay strong and be able to employ people. When we lose these subsidies, we're going to see and of course that's it's not 4.7% in every community. There are some pockets of New Hampshire where the uninsured rates are much higher and somewhere it's a little bit lower. And those are the spaces where I'm really concerned. I think the more rural parts of the state are going to see higher rates of uninsured because they tend to be the spaces where folks are either living in lower socioeconomic bands, they are gig workers or self-employed. They're older adults, but they're not yet Medicare eligible. And it's those communities that can least afford to lose stability, because those are the places where the hospitals and the providers are already struggling to stay in business. So I think there are statewide strategies we can take, and I think that there are community-wide strategies that we can kind of look at, and I'm hopeful that the state will continue to recognize their role as kind of leaders in that space, with the insurance department and the Department of Health and Human Services coming together to really look critically at where we need to be shoring up and investing in these spaces. So regardless of what happens with the ACA, at the federal level, the Rural Health Transformation Project in New Hampshire will shore up the infrastructure that we've been building over the last 10 years, so that we know there will be losses, we know there will be slides. How do we protect the economy and the health of folks who live, work, and play in New Hampshire, so we continue to retain that advantage?
Thank you, Tory. And this
Tory hits on an important point. We got 5 years of the Rural Health Transformation Funds. And when I think about investing these funds, you have to invest them in something that lasts longer than whole milk left on the counter overnight. These are not invested in operations. These are invested in infrastructure. It could be workforce development infrastructure. It could be physical plant infrastructure, especially as we have an aging population. There's concepts called hospitals at home. That's an interesting concept. Augmented intelligence may have some interesting opportunities, as much as we don't know about it. So there is some opportunity to really invest, so that we're not, as I just saw Wayne Gretzky this morning. I had the pleasure to meet him. It was always skate to where the puck's going to be.
Yep.
So we kind of have a sense of roughly where the puck's going to be in 5 years. Got to figure out how to skate to that point. It's going to take a lot of collaboration. Luckily, in a small state like ours, working with DHHS is a pleasure. We know each other on a first name basis. We row in the same direction. So I think that is an advantage of a small state like New Hampshire. Is we're limited in resources, we're not limited in human cognitive resources.
Well, thank you both. This has been a really deep and beneficial conversation about open enrollment and all the issues swirling around. And I want to save some time, because I know we've got some media friends on the call, to see if they want to ask questions. If they do, we have a Q&A feature in the Zoom. If you type in your question, my colleague Rachel or I could ask the panel and get you an answer to your question. Introduce Rachel. I see you're on screen, and do we have any questions?
Hi, thank you, Jayme. Thank you to everybody else for being on today's call. If I would like to start our Q&A with a question that was submitted ahead of time. And this is for both of our speakers today. That is, how will higher premiums due to the ripping away of the tax credits impact the personal finance of granite staters who rely on them? What will happen if they have to forego care altogether, or sacrifice other essentials from their budget to accommodate these higher premiums?
So I thank you, Rachel, for the question. I think the short answer is that folks are going to be less healthy, and they're going to be more at risk for that to be a problem for a really long time. And those are both things that we have invested hugely in over the last couple of decades in New Hampshire. That's what's so heartbreaking, is folks have worked so hard to get here. We do see cost pressures on housing and food and electricity and all of the things that our activities of daily living require us to spend money on. So I'm really worried that we'll start to see individuals and families making decisions to survive that will have an impact on their kind of day-to-day health and on their long-term health, which over time are both very, very expensive.
I would agree. And when I look at it, I think part of my frustration is these investments we put in our friends, family, and neighbors in their healthcare produce demonstrable results. And at ACHS, and we're not unique in this perhaps, we're number 2 in the country for colorectal cancer screening. We're in the top 16 for overall cancer screening. We exceed healthy people goals in depression, diabetes on a regular basis. In order to do that, we have to do this funny thing called see the patient. And our staff like to have a roof over their head and food on their table, education for their kids and their elderly people well cared for. So again, we need to compensate them at a fair and equitable rate. So it is a little frustrating to see a disinvestment into health and wellness. Economically short-sighted, as Tory pointed to, if I just use our own health insurance, if we had chosen to stay with the silver plan instead of paying last year's premiums for a lesser plan for less care, it's a 20% hit. So you can think about, well, 20% has to come from somewhere, and it's gonna come from somewhere in the community where I otherwise would take these dollars to the bookstore, to the coffee shop. Maybe I don't buy a new car. Those are sorts of some things you cannot buy and it doesn't have adverse impact. For some people, they're going to make decisions because they have no choice, and it will have an adverse impact on their health and wellness, let alone their quality of life. And I think Tory's right that these sorts of it's easy to break things. It is difficult to unbreak things, and in some instances you can't unbreak them. So it's I don't like what I see coming down the road. It's disconcerting, to say the least. I worry about my friends, family, neighbors, and what their health is going to be like.
Thank you both. And Jayme, did you have something you wanted to chime in on as well?
Well, we have a question from a colleague in the press, which I'll share with our panel, and it's a fair one. There was a 95% cut to Navigator funds this year for open enrollment, and the question is it clear that the Navigator system can support the deluge of requests for help, especially when the shutdown ends? As you likely know, we are already seeing the Medicare Advantage infrastructure be swamped. Merrimack County isn't taking any appointments to help seniors through the end of calendar 2025. So I'm guessing that the thrust here is the Navigator system sufficient to help those who are be looking for support with open enrollment?
So I think the short answer is no. I mean, it's clear that the Navigator system really hasn't ever been adequate to help folks enroll. So that adequacy is only becoming less reliable because we are seeing cuts to the staff and we're seeing so much uncertainty. It's really tough to keep on top of the rules. What do I do? Well, that depends on what you believe will happen next. Well, who's got the crystal ball? That is really, so it's challenging. And it's a challenge from a public health perspective because public health works well when folks trust the messages that they're getting. When we're telling folks we don't know, that's a really lousy message to send to people. We don't know what to tell you, because your situation could be different based on these multiple things that we don't have certainty around. We're from the government. We're here to help you. Yeah, that is challenging. So it's a really good question. But the short answer, I think, as much as it's ever been adequate, it's only going to be less adequate.
I think Tory hit on a key element, and I think the key element is the uncertainty. That if there were certainty there are a variety of people who have been in the marketplace for years who pretty good, right? Figured this out. It's constant. I can go self-navigate. Um, well, with the uncertainty, even though I can navigate the system, I have a bunch of questions that I didn't have to ask in the past that I have to ask, some of which there are no answers, like she said. And that puts an undue burden on a static level of navigators, let alone a decreased level of navigators. We've always had two. They've always been certified assisters. I haven't had a chance to talk to them. It's just starting, and I can anticipate they'll be overwhelmed. I know that when I spend time in libraries, if you really listen to what librarians do, and I don't want to accidentally have people, please don't rush to the librarians and overwhelm them. They're probably not certified assisters. They're extremely knowledgeable in helping you find things. If you watch what they do, they act like community health workers because people go looking for, where do I do a job? How about food? So libraries are a great potential resource for a lot of good work being done. They're underfunded as well. So and some of them naturally just kind of figured out certain things and they want to be helpful. But yeah, Tori's absolutely right. It's a bit of a tidal wave that was self-inflicted. Nobody asked for this, and here we are.
Maybe we can see if the National Guard is available to man the phone banks again.
Yeah, that's an interesting idea. It's during the pandemic, they're hyper local people. They have jobs and friends and families in the neighborhood, and you're probably right. You could probably that's an interesting concept.
Well, I just came back from a conference in Washington, D.C., where there were National Guard members on all the subway platforms, and the healthcare provider in me says, I bet they can feel better about their work helping people get connected to healthcare than they were feeling about the role they were playing. So.
And certainly if you go on to healthcare.gov,
we could put QR codes on their uniforms that take you out to healthcare.gov.
But on there, if you
enter
your physicians, your specialists, the place your federally qualified health center, it'll tell you which plan covers what, which is the number one question that people have. So that is there. You can always call your doctor's office, your health center. The resources are less, but the answers are still out there. And I think one of the things I'm taking away from our conversation today is this is about community health. And we all have to stay healthy to keep our neighbors healthy and the people we love healthy and the people we care about healthy. And there are plans on the exchange that with certain income levels cost nothing a month. They don't offer a ton of benefits. They do offer the basics, but they're an emergency critical stopgap that at a certain point they kick in and you're not looking at $100,000 that you don't have for a healthcare crisis that you weren't anticipating.
That's the bottom line, right, Jayme, is that those catastrophic plans exist in wholly to keep people from losing their homes and their livelihoods. They're not designed to help folks stay healthy. They're just designed to help them stay afloat. And that may be what some folks need to do for a while. I would also encourage people to reach out to their own communities, Facebook, X. There are individuals who are really good at this stuff. They're not certified navigators. They just happen to be people who have done the research and walked the walk. And it's, your mileage may vary, caveat emptor, all of those things apply, but our community is what gets us through. And this really isn't any different. I think we need to demystify it, that it's some magic box that only the government knows and can administer. The government helps share information and helps craft the information, but it is a little bit of a runaway horse right now in that no one's got the lane lines organized, and we all just need to make the best decisions we can with the information we have at the time and understand what the potential consequences are. And that is new every day.
And you know, there are 4 companies offering plans for the exchange in New Hampshire right now. They all have 800 numbers. You can ask them about somebody else's plan, about their plan, and they're happy to take your call. So if you've narrowed it down to 2 companies, you can call and talk to them. I want to say thank you. I'm sorry, do you have something else to add? Because I was going to wrap up, but I don't want to cut you off. No. Okay. Well, I want to say thank you then. This has been an incredible conversation, and I feel badly that this information isn't getting out. So thank you for helping us get it out to New Hampshire residents. It's so, so important that we stay healthy, that we have access to a healthcare system that is affordable and comprehensive. We're going to come back in 2 weeks and take a pulse check of what's going on with open enrollment. I promise you that, because we're not going to let this go. It's very important to help people know what's going on and answer their questions. So, Tory and Ed, thank you. This has been a great conversation. I really appreciate you being here. And thank you to Rachel. I'm Jayme Simões. We're here on behalf of Protect Our Care New Hampshire. Thank you for talking about open enrollment. And let's keep up that hope that things are going to go well. People are going to sign up and we're going to find a way through this. It means a lot to everybody. So thanks again.
Thanks, everyone.
Great, thank you.